everybody, welcome to Let's Talk Show with Sophia Dhahabu. On today's topic, we are discussing about cervical cancer. And with me today, I'm joined by Dr. Karanja, who is a specialist on cancer. So welcome, Dr. Karanja.
Thank you very much.
Good to have you.
My pleasure.
Tell us about yourself before you tell us about cancer.
All right. My name is Karanja Samuel. I'm a radiation therapist by profession, having just completed school. I went for clinical practice at the Kenyatta National Hospital and more recently at Kenyatta University Teaching and Research Hospital. So I'm quite informed about the topic, and it's my pleasure to interact with you and exchange ideas about the same.
Wow, that is amazing. Now, let's start from what made you to specialize with cancer?
Well, ever since I was in school, I used to love biology, chemistry, but then again, when I became familiar about the sufferings that the people, especially in the African continent, are undergoing, I discovered that cancer is actually a huge burden, and so I decided to venture into that field so that at least I can do my part with regards to helping people.
Now, allow me to just divert a little bit, but do you think there are a lot of doctors that are specializing, a lot of people that are specializing in cancer?
Well, there wasn't, but the good thing is we are building capacity, so many more are joining. So in the next few years, I think we'll have enough man capital to handle the cancer epidemic, as it were.
Now, here comes the question, guys. What is cancer?
All right, cancer in a simple way is what you'd say abnormal cells dividing to produce more abnormal daughter cells. You know, cells reproduce by cell division.
Okay.
So if the parent cell is abnormal in any way, it will divide to produce a replica of exactly the same as the parent cell. So if a cell is abnormal, it will definitely produce abnormal daughter cells.
Wow.
Yeah.
So that is bad, according to science.
It's very bad.
You know, my viewers, I have very many people that don't understand cancer. So when I am asking this, I know I'm asking for a lot of you. So let's talk about cervical cancer. Now, what is cervical? What is cervix? What is all that? Try and explain all that.
Okay, to explain cervical cancer, it's important that people first of all appreciate where the cervix is.
Okay.
So anatomically speaking, the cervix is located in between the rectum and the bladder, and it is located 90 degrees to the vagina.
Okay.
Yeah, so when we talk about the uterus forms the cervix inferiorly. So I'm saying the cervix is part of the uterus, so that people understand. You know, people know the uterus.
Yeah.
Yes. So the uterus is divided into two.
Okay.
The upper 2/3 and the lower 1/3. So
Okay.
the lower 1/3 of the uterus is now the cervix.
So, and when you say about, all along, by the way, I knew that cervix is, I thought it was outside the vagina, around that place. I thought about that. So, so what are the chances of one getting cervical cancer, and what is cervical cancer?
Cervical cancer is the cells that make up the cervix.
Okay.
When they undergo abnormal transformation,
Okay.
and this transformation is not mitigated, it would eventually lead to development of abnormal cells in that area, and that is what we now call cervical cancer.
So now, do you think that the younger generation are at a better place to not get the cervical cancer than the older generation?
Yes, I'd say that currently now technology is favoring the younger generation.
Okay.
In that the main cause of cervical cancer is human papillomavirus, which is actually sexually transmitted.
Okay.
So recently there was a development of HPV vaccine.
Oh.
Yes.
Okay.
But this vaccine is better suited for people who are still virgins, who have not engaged in coitus. So if people can adequately...
Doctor, coitus is sexual intercourse.
Yeah, so if you can get your teenage daughters, teenage women to get vaccinated before they actually expose themselves to sexual engagements,
Okay.
then we'd be protecting them from the human papillomavirus, which is the main cause of cervical cancer. I would say about 90% of cervical cancer is caused as a result of HPV.
So HPV is lack of vaccine?
No, HPV is the virus itself. It's called human papilloma virus, HPV.
Okay, all right. So now I'm gonna rephrase the same question.
Okay.
Do you think somebody like my mom has a high risk at getting cervical cancer than myself?
Well, that is actually quite tricky to answer because, you know, after understanding what causes cervical cancer, which is HPV,
okay,
and HPV is a virus that can lie dormant in your body for up to 30 years and 40 years. So you might actually acquire it when you are 20, and then it might cause cancer in your 50s and your 60s. Okay?
No way!
Yes, and then you understand that HPV also does not cause any symptoms. So when you have it, you are okay. So that's why people don't go to the hospital to screen for HPV. You understand?
No way!
So your mom might have it. You might also have it because it doesn't cause any symptoms, no pain. You wouldn't know. You understand? Yeah, that's why I'm saying it's better to vaccinate against it, so that, and mind you, the body clears HPV by itself.
Wow.
Yes, about 90 to 95% of people will get HPV at one point of their life, but the body does a very good job of clearing it out. It's only the 10% that their bodies fail to clear the HPV that the HPV actually builds up in their body, leading to development of cervical cancer.
That is interesting.
Yeah, so to answer your question, you would both be bearing the same risk because none of you is vaccinated.
So my question again would be, can somebody at their older life get vaccinated?
Well, that would be a no, because of course the vaccine is intended for a particular purpose, to prepare the body against the invasion by these viruses. All right, so that is why the vaccine is given to people who are still virgins, so because the virus is sexually transmitted.
Wait, Daktari.
Yes.
So you mean somebody that is not a virgin cannot get vaccinated?
You can, but the efficacy of the vaccination wouldn't be as good as that of a virgin, because okay, even if you're not a virgin, for example, and you have engaged in sex, it does not mean that you have been exposed to HPV. All right?
So the HPV normally has a high risk of getting into you or to you when you engage in sex.
Exactly. It is sexually transmitted.
Okay, I don't know about you guys, but I didn't know about that.
Yes. So that is why the people who organize the vaccination target people who are virgins, because they are guaranteed that these people still do not have exposure to that virus in their systems.
Wow, guys, I didn't know about that.
Yeah, and yeah, it's good to know, because you know people know about STIs and everything, but there's still less information about HPV.
Do you know, I think we've been educated about gonorrhea, syphilis, all those kind of diseases, but we've not been educated about cervical cancer. So most of the times you will think that you are safe on this other side, but negate the other side. So this is knowledge.
Exactly. Yeah, so that is something that you should actually inform people, that the young generation should seek to be vaccinated, and especially high school children, people before they actually engage in these acts. It's actually better, even with regards to the efficacy of the vaccine, to target people who are yet to become sexually active.
So vaccine means that you are not at a high risk of
Vaccination means introducing a weaker form of the virus to your body, so that the white blood cells can get aware of the structural composition of this virus, so that they can prepare to fight against it should you be exposed to the real thing.
Daktari, this is interesting, guys. So now my question comes to, what of the person that was just vaccinated after maybe high school or whatever in high school? What are the chances of them getting the cervical cancer, even after the vaccination?
Okay, I'd say the chances of them getting cervical cancer are greatly reduced compared to unvaccinated people.
Okay. What are the chances that once you are, for instance, once you, let's now talk about treatment. Assume somebody has cervical cancer and she doesn't know, but she goes for, you taught me something today before we started doing this thing that we're doing. You taught me about pap smear. What is pap smear?
Well, pap smear is a part of cervical cancer screening, where you visit your gynecologist.
So wait. Screening, you mean like test?
Yes, testing.
Okay.
Yes, it's actually advisable that women above the age of 40 should be going biannually, 2 times a year. This is informed by the fact that people under the age of 20 or in their 20s are less likely to develop cervical cancer. In that, first of all, the causative agent of cervical cancer, being HPV, would first have to lie dormant in the body for a period of time. So even the populace, like in America, the average age for people acquiring cervical cancer is 50 years. So that is why we are saying people over the age of 40. You understand? Yeah. Because that is the average age that people actually get cervical cancer. You see. So it is recommended that people go for screening 2 times a year, biannually. And the screening now involves pap smear. Now, pap smear just involves collecting cells from that area, from the cervix, and then those cells are taken to the lab and are observed under a microscope to check for their structural integrity. You know, the way if they are still normal, because before a cell becomes cancerous, first of all, it changes in terms of morphology, which is the structural buildup. Okay. Yeah.
Assume I am in my 30s. I go get tested. Do you think they could, when you're doing the microscopic whatever thing you guys do, do you think you can find symptoms or cells that are saying that I could have cervical cancer?
Yes, in your 30s, we could still find symptoms informing us that you might develop cancer. But one thing you should understand is that cancer doesn't just develop out of the blue. When the cell is transforming, it takes a period of time. So actually, there is precancer, a stage called precancer. And this stage is where now your cells are actually transforming from being normal to the abnormal, depending on the stimulus that is acting on them. Now, in this case, being the HPV virus. So that stage is called dysplasia. You see? Dysplasia. The cells are abnormal, but are yet to be cancerous.
So can the cells be dealt with?
Yeah, exactly. So that is the reason why we need screening. Because if we were to find out that you, a part or a portion of your cervix is undergoing dysplasia, then it's easier for us to mitigate before you now have cancer.
I think guys, I'm learning a lot. So when you are doing the screening, assume I'm the one, I've not even gotten to my 30s, right? So you get that my body has those particular cells, HPV you called it, right? You find that I have HPV cells or whatever.
HPV virus.
HPV virus. So treating them would be easier than treating cervical cancer, number one.
Okay. I'd correct you there. When you are doing screening, we are not screening for HPV virus, all right? We are screening to check your cells, yes, if they are still normal. And now, as a result of HPV...
So you can find that when you're screening me at my 20s, you can see that there are cells that are abnormal.
Yes.
So those are the cells you're trying to treat.
Yes.
So if you treat the cells when I'm in my 30s or 20s, it means that when I get to 50s, I won't have cervical cancer or whatever.
Yes, exactly.
They wouldn't have matured.
Yes, because actually we remove them. We remove those cells that are showing transformation, you see, to prevent risk of they developing into cancer later.
My viewers, you gotta be learning this. So is it expensive to remove the cells?
Well, I'd say...
than treating cervical cancer?
I'd say it's not expensive compared now to the costs that you would incur later if you fail to do this now. Understand? Like the cost of prevention of treating this disease early is less compared to what you would incur now when you're treating disease in an advanced stage.
Wow. So you actually recommend that I go and do one?
Yes, I recommend people to go for screening. Of course, now the age for screening is 40 years.
So, since I'm not 40 right now, I can go do the screening?
No one is going to turn you away when you go to the hospital for screening. It's just that the recommended age.
My own thinking. It's better for the younger generation to go for screening so that you can remove the cells. Well, if there are chances you find that this chick has some cells that are abnormal, you better remove them than treating when somebody is 40.
Yes, I agree with you. The earlier the better.
Yeah.
But now these things are informed on statistics. All right.
Okay.
And the statistics show that actually the age gap where people develop cancer is around 45 to 50. So that's why they decided in their own intelligence to put the recommended screening age at age
I like what
40.
you said, in their own intelligence. That is, there are symptoms that will show that, ish, my body is not doing well,
Yeah.
guys. My body is not cooperating.
Yes.
So what are the signs?
Well, with regards to cervical cancer,
Okay.
we have divided the symptoms into two. We have symptoms for early disease and symptoms for advanced disease or late disease. So symptoms for early disease, one would be post-coital bleeding.
Coital sexual intercourse, guys. I have to insist.
Yes.
Perfectly.
Yes. And then another symptom would be bloody discharge.
Bloody discharge.
Yes.
So it doesn't, okay.
Doesn't involve sex. You might
Okay.
just have discharge on its own. And then also we have discharge with foul odor.
Okay.
Yes, so those are the symptoms for early disease. Now, when you're talking about late disease, you would have
So let you mean
advanced disease.
Okay.
Yes. Now you would have pain in the groin area and even extending to the legs.
Wow.
Yeah, you'd have swelling of the feet. We call that edema.
Edema.
Yes, edema,
Ish.
swelling of the feet. So those are the main symptoms that you would experience. So those are the things, the presenting symptoms that a person would come to them, come with at the hospital, and then just by listening to the patient, I'd be able to tell, okay, this is indicative of cervical cancer, and then now we start the due process. So due process involves sending the patient for imaging, sending the patient to the lab.
Wait, Daktari, what is imaging?
Or medical imaging. So we'd want to do like CT scans, you see. Yes, and then we'd send the patient to the lab for a biopsy so that we can understand the histology. No, the histology refers to the type of cell that is actually now cancerous. You know, the body has very many cells.
Now, I'm about to ask a question, guys. Do you think this thing can be, I don't want to use that word, but hereditary?
Yes, in every disease, there's a place for genetics. Every disease, there is a place for genetics. So even with regards to cancer, remember I told you that 90% of cervical cancer is caused by HPV. So we still have this 10% remaining. So this 10%, there is a place for genetics.
Wow. Wow. That is amazing, guys, to know that. So now, Doctor, you've talked about early symptoms and late symptoms. So now assume that somebody has seen all this. What is her first step or their first step?
Okay, when you experience symptoms, the first step should be at your physician's doorstep. All right?
Gyna.
Yeah.
Okay.
And your gyna will definitely understand what is going on and will recommend the things that I have stated. Send you for imaging, send you to the lab to understand the histology, and then depending on the results now of the testing, they'll develop a treatment plan.
I know, my viewers, you are enjoying this great conversation with Dr. Karanja, but allow us to take a break. We will be back in the next episode. Please remember to subscribe, to like, and remember also to ask your question on the comment section, okay? I would love to ask Dr. Karanja every question that you have.